Now for sensory system, the first thing which is very important is called receptors. What is receptor? It is a transducer which will convert the stimulus into a nerve impulse. Any type of sensation will be called a stimulus. That sensation will be converted into nerve impulse by these receptors. Okay. So what are the receptors? First we classify according to the location. So first classification based on the location. It is called exteroreceptors, which lies in the external environment of the skin and other parts. Pain and temperature, touch and pressure. These are called carried by exteroreceptors. Hearing, vision, smell, taste. These are all special sense receptors which lie externally. So these are called exteroreceptors. Coming to the second called proprioceptors. Proprioceptors are those receptors which will carry the muscle sense, joint sense, vibration sense. So they are called proprioceptors, which is present in the neuromuscular spindles, in the tendons, joints. The joints, they are the kinesthetic sensation which is being carried by these proprioceptors. And the inner ear, there is a hair cells which will carry the vibration sense to maintain the equilibrium. So these are called the proprioceptors. First is exteroceptors, then the proprioceptors. Then the third category is called interoreceptors, which lies internally in the blood vessels or in the viscera. This sensation will not reach to the level of consciousness. They will give the sensation of a pain. So these are called interoreceptors. Receptors present on the blood vessels and the viscera to carry the sensations. Stretching reflex is carried by this type of interoreceptors. Now classification based on the microscopic structure. First is the non-encapsulated nerve endings. The free nerve endings which will carry the pain, touch, pressure and the crude touch. Pain, temperature, pressure and the crude touch is carried by the free nerve endings. Then the root hair plexuses, then the Merkel's disc, the touch of the palm and the sole. The palm and the soles, they are carried by this Merkel disc, the crude touch sensation. These are the non-encapsulated nerve fibers. Coming to the encapsulated nerve fibers, they are the Meissner's corpuscles, the Pacinian's corpuscles, the Ruffini corpuscles and specialized sensory cells. Though this is according to the microscopic structure, some of the nerve impulse neuroreceptors are encapsulated, some of these are not encapsulated, which will carry the non-encapsulated nerve endings. They are basically the free nerve endings, which is carry the pain, temperature, touch. The touch is crude touch and pressure. The root hair plexus, Merkel disc, which will carry the touch sensation of the crude touch sensation, palm and the sole. And the encapsulated nerve endings are the different corpuscles, Meissner's corpuscles, Pacinian corpuscles, Ruffini's corpuscles and the specialized sensory cells. Then next.